everybody. This is Dr. Roya from Farnova Medical Group, and we're going to talk about urinary tract infection today. This is the fourth program we're going to have, and generally, the urinary tract infection is more common in women and less common in men. If men get that, then they usually should go to see their doctor. However, for women, it is way more common and it's easily treatable many times with these kind of treatment. I usually treat that in my office with some of the common things or prevent it in people who get recurrent urinary tract infection. The prevention usually is related to what a person does. Sometimes it's the urine infection after sex, or it could be if they're doing their bath in, like they take a bath, or if they have a lot of drinks which have got caffeine in them, or eat chocolate which has got a lot of caffeine in them. So whether it's coffee, tea, energy drinks, or pop, all of them, they are caffeinated and they would cause way more urinary tract infections. For that, one of the first things that the person has to do is cut back on those kind of things and drink more water. Water washes out the kidneys and the bladder, so as a result, there will be less infections. The common thing I would suggest to people do if they have any of the symptoms, which commonly is either urinary burning, when they pee, they actually have burning, mainly at the beginning of it. They can have some blood in it sometimes. That's usually less often seen, but it's possible. There can be after they've had a urinary stone. It could be a fever, which is again less common unless it's more infected and maybe it's caused sepsis by that time. The low back pain is a very common thing, and confusion in elderly is a very common thing, especially those who are in places like in homes and all. They're kept there, or else they're in the hospital. That's a very common thing to have. They can also have pain where the kidneys are, which is in their flanks. They can have pain, and that's another thing. Now, if there are any of these number of things, then you can think of that. Or if you get recurrent urinary tract infection, then you know already what your symptoms are. Sometimes people feel just weak and they don't know what's wrong with them. And that could be just a common symptom also in elderly. So the common treatment for that I suggest is drinking a lot of water per day, but before breakfast, lunch, and dinner. Another thing you can add to the water would be just a pinch of baking soda in one of those drinks, or you could have a teaspoon of cinnamon. You can put that into your mouth and then drink the water after that, along with a teaspoon of honey if you're not allergic to that. Or you can have some cranberry, crushed cranberry. Cranberry juice usually is full of sugar, so it doesn't really help because sugar allows the growth of bacteria. But if you have fresh cranberries or crushed cranberries, or you could crush the cranberries and actually freeze it and then make ice cubes out of that, ice cranberry, crushed ones, and then put it in a warm water or lukewarm water and then drink it. But all of these drinks has got to be at least 15 minutes before your breakfast, lunch, or dinner. 3 times a day for 2 days usually does the trick, and people usually get better. So if that heals you, then you don't have to go see your doctor or take antibiotic. Again, that is only if you don't have symptoms of fever or flank pain and stuff like that. If that's the case, then it's a wise thing to go and see your family doctor. And if it's a recurrent one, then these kind of things can prevent it. You could also have these drinks before sex, or if you're taking a bath, then you could do it after or before it, so that you can prevent having urinary tract infection. I hope this helps, and let me know in your comments If it does help you and if there's a problem, let me know and we'll respond to you. Have a wonderful day and stay healthy.